telemedicine is obviously not your usual line of business, but at times you might be challenged to provide care in a clinic-like setting. Your average patient is likely to be young and otherwise healthy, but you might happen to care for folks who take you out of your comfort zone. Being an ear doc, I'd like to offer you a few general pointers on how to handle the undifferentiated patients in acute and emergent settings. As you walk into the patient care area, there are some things you see, hear, and smell. Oh, don't worry, I spare you naming those smells. However, all these sensory impressions help you form this very first idea whether your patient looks sick or not. You may call it your gut feeling, and it is actually a pretty powerful clinical tool, especially when backed up with a single set, or even better, a trend of vital signs that you should obtain ASAP. If the patient is sick, then resuscitation obviously trumps anything else. But if they look okay, or after the initial resuscitation, you can start gathering the intel that is patient history. In real life, patients can be pretty difficult historians. While some clearly tell you what exactly their problem is, others tend to use metaphoric statements and enigmatic descriptions. Don't make any assumptions and always ask them what they had in mind. Let's not forget that you aren't running a continuity clinic, so it's very important that you figure out why your patient is here today. Especially if their symptoms have been going on for a while, you must attempt to find out why of all days they picked today to seek medical attention. Help them establish a clear timeline of signs and symptoms as they occurred. Give your patient enough time to gather their thoughts and avoid the temptation to suggest the answers too quickly. It's not a multiple choice quiz, but if you keep throwing out suggestions, your patient may just pick one, even if it's incorrect, to have you stop pushing them. Always start with open-ended questions, but it is on you to keep your patient on track and redirect them if they start jumping from one thing to another. I have to add that if you're working in some overseas setting, it is quite important to consider the cultural aspects of your patient's presentation. Your translator is unlikely to have medical training, and as an example, in some African cultures, to say that you have chest pain might indicate an expression of guilt and not a medical emergency. While you're trying to figure out what's going on, you must be mindful of monsters and serial killers. Strive to rule out immediate life, limb, or vision threat and treat accordingly if such is present. Keep your differential diagnosis short and straight to the point. It would best include the lions, tigers, and bears. That is the condition that could seriously endanger your patient in the next 5 minutes, 5 hours, or 5 days. You certainly shouldn't be focusing on zebras. And mind the extremes of age. Be particularly cautious when dealing with the very young and the very old. In those patients, life-threatening conditions may have very subtle presentations, such as sepsis without fever in the elderly. I would also want to caution you against over-relying on classic constellations of symptoms, as those aren't actually that common. Instead, at times you might be dealing with an atypical case of a common problem. Appendicitis is a great example of such a chameleon illness that cannot be dismissed even if the symptoms don't sound quite typical. If you find yourself providing medical care in the middle of nowhere, your resources are generally rather limited. You're always going to ask yourself if you can handle a given problem locally on your own, plus minus a few hints from a telemed dog, or does your patient need to be evacuated? When in doubt, call for help. And if you have this option, it's better to call early. Be prepped for your telemedicine consult and own this conversation. Grab your consultant's attention with a one-line summary which states who you are, where you're calling from, followed by some basic patient's demographic, chief complaint, and a word about pertinent past history. After that, fill them in on the story in further details, add a full set of vitals, and a focused summary of clinical exam findings, and state what you need. Be ready to pin down the recommendations, and don't forget to ask for the easiest callback method.